right, good morning, everyone. It's Maria Manriquez here. I'm obstetrician gynecologist caring for patients with addiction and substance use disorder. We are in our Beyond Addiction series. We have three actual main series. The first we call Series A, which is addressing pregnant and parenting women specifically in management of their care with MAT. And the second is the Arizona Department of Health Services in collaboration with the provider schools throughout the state of Arizona in re-looking at how we educate providers on pain and addiction. And then the final series 3, or C, I apologize, is basically our community and the community efforts that exist and making sure that the providers and other individuals caring for patients with substances are aware. So this morning we have Emily Singleton from Parent Partners Plus here to present on home visitation coordinated referral systems. And we'll go around real quick and introduce everybody, if that's all right, just because I know y'all can see us here. And so we'll start over there, if you don't mind.
Hi, my name's Catherine. I'm a medical student planning to help with the project and kind of look at some of the data that we'll be collecting through the project.
Thank you.
Hi, my name is Christina. I am also working with Dr. Manriquez as her program coordinator.
Good morning, my name is Kristen Pineda. I am Dr. Manriquez's program manager.
And with that, we are going to turn the controls over to Emily and thank her very much for sharing with us today.
All right, thank you so much. Let me get this pulled up here. So let's do this. All right, so my name is Emily Singleton and I'm with Parent Partners Plus. We are funded by First Things First to operate a coordinated referral system for home visitation programs here in Maricopa County. Parent Partners Plus is a collaboration of many different programs, but we are actually housed at Southwest Human Development. I don't have any conflicts, and this presentation doesn't reflect the views of SAMHSA or HHS. So a little bit about Parent Partners Plus. I'm going to be talking about home visitation. I know some of you are probably outside of Maricopa County, so most of what I'm talking about also applies outside of Maricopa County as well. But just in Maricopa County, we do have this coordinated system. So we are a program of Southwest Human Development, and as I said, we're funded by First Things First. Our home visitation programs focus on serving families who are either pregnant or have a child up to age 3. So most of them enroll before the child turns 48 months. So we're really focused on that early time period and getting families the connections and the services that they need early on in their child's life and the information to help them be the best parents they can be, as we say. A little bit about home visitation. You know, it can mean a lot of different things, but when I'm talking about home visitation, I'm specifically referring to like early childhood home visitation. You know, there are definitely, you know, obviously DCS does home visits, and there are many different programs that might offer some kind of home-based service. But home visitation as kind of a method of service delivery for early childhood and pregnancy is what I'm going to be talking about today. And if you can see on the slide, for those of you who are able to see the slides, you know, this house, it's like a nice kind of suburban house. Obviously, we know a lot of our families' homes do not look like this, but this slide just kind of illustrates the services that are offered by home visiting programs. So all of our programs, there are many different models. but they all are offering developmental screenings, information on child development and early learning, social support for families, because we know that's such a big issue for families, especially I feel like a lot of families in Arizona are kind of from other places. You know, they've come here for different reasons, but so they might not have like a lot of social connections. Referrals to community services, whether that's connecting them with a food bank or a jobs program or whatever it might be. And then linking families for enrollment in public benefits like Access, WIC, SNAP, those kinds of things. So really just helping families connect with what they need. And the nice thing about home visitation is that it's really individualized to what the family needs. Because it's one-on-one, they're not really just prescribing things for families that they might not need. Some families, you know, they might already have a job, so they don't need help with that, but they really need help with their child's development, or they need information about breastfeeding or whatever it might be. I'm going to go through a little bit of the program models that we offer. Many of these are national models that are either evidence-informed or many are evidence-based. So they've gone through rigorous trials to prove their effectiveness for helping families. The first one is Early Head Start, which is a national model. It's a federally funded program. And they do offer services for families who are pregnant. A lot of people think of, you know, Head Start or Early Head Start as just being not during the pregnancy, but they actually do start prenatally. Many of our programs do, because we've seen that that's a critical period for families when they're really making those decisions about the kinds of parents that they want to be. And our programs want to start as early as possible to give them the tools that they need to help them succeed. Family support coordination here in Maricopa County, and I believe it's offered in other places throughout the state. It's a service of the Family Resource Centers offering short-term case management. Fussy Baby Program is a program of the Birth to 5 helpline, which offers support for parents who have a new baby who might be difficult to soothe, or maybe just has some other medical challenges, including, you know, NAS. Healthy Families is it's a statewide, it's also a national program. Their target enrollment age is pregnancy through the first 90 days of the child's life, but they can work with families for up to 5 years. So really supporting that family up until the child starts kindergarten. That's the focus of this program. That's our longest longest time period, like the families can be in the program. Most of the programs are more like 2 to 3 years. Healthy Families is 5 years though. Health Start is a program offered through Arizona Department of Health Services. It's a statewide program that uses community health workers to work with moms prenatally and up until their babies turn 24 months old. High-risk perinatal program is what some people might know as the newborn intensive care program. They work with babies who've been in the NICU for 5 days or more. Nurse Family Partnership, you're going to hear a little bit more about that one later, because I have a nurse, Beth, who's going to be helping me with the case studies a little later on. Their program targets first-time mothers who are under 28 weeks gestation, which sounds like a very narrow criteria, but they've shown that they can have some really amazing outcomes for families working with this population. Parents as Teachers is probably one of our most broad models. They work with families who are either pregnant or have a child up to 48 months, and some models, some of the agencies enroll up to 5 years old. South Phoenix Healthy Start is a program offered here in Maricopa County. I believe it's the only one in the state that offers Healthy Start. There's Health Start and there's Healthy Start, so that's why we have a coordinated referral system. And they also use community health workers. They also have doulas on staff. They have an awesome program called Doulas Behind Bars, where they actually have doulas who work with moms who are in jail. So that is a really amazing program, doing a lot of good work in the community. Side by Side is a program of Southwest Human Development that offers support for families who have a child who has a developmental concern but doesn't qualify for AZIP services. Smooth Way Home is a program also for families who don't qualify for AZIP services, but the focus is if they have been in the NICU, and supporting them as the family is exiting the NICU and coming home. All right, so that kind of gives you a little bit of an overview of the different models. The cool thing about our program is that we do the intake and screening so that you as social service providers and physicians do not have to know all of them. Basically, we have something for everyone. They all offer the child development screenings and information. They're doing maternal mental health screenings, connecting families to community resources, goal setting for parents. As I mentioned, it's very one-on-one. It's whatever, they have a curriculum, but they really try and help parents with whatever their goals might be. I've worked with families who might have the goal of going back to school or finishing their high school diploma or going to college. I worked with a family who had the goal of starting their own business. So really just helping them and supporting them with whatever their goals might be. And then of course the parenting information and support. There's so much information. As you all know, you can type in, tantrums on the internet and you'll find like 30 different ways of dealing with tantrums. And our home visitors really work with families on evidence-based practices that are going to work for the family, for their situation, and whatever their parenting concerns are. Here's some of the outcomes. There are a lot of outcomes. There's a ton of literature out there around home visitation, but just some of the main points I wanted to show are especially nurse-family partnership and healthy families. They both show up to 70% reduction in pregnancy complications when participants are enrolled prenatally. So the prenatal enrollment is very important. Also, for many of our programs, the parents had some form of health insurance. So we're really trying to connect them with access or whatever it might be, that be able to offer them health insurance. And then, excuse me, nurse-family partnership actually shows lower rates of preventable child mortality up until age 20. So that shows that getting in there early, those nurses getting in there early can really help across the lifespan, not just in the early childhood period. This is a table. I'm not gonna, I know I'm kind of, I don't want to take up too much time, but this is just kind of is a comparison of the different programs and how they help. So you can see that all of them, they're helping with the child cognitive, motor, behavioral and social emotional development. The parenting stress levels are down because they have someone in the home to work with them, ask their questions, connect them with community resources. The parents feel like they're not alone and just having to do this on their own. They're all getting connected with community supports. They all show reductions in child maltreatment. And many of them, 2 of them actually have shown that they have decreased substance abuse among participants in their programs. I'm going to go over the centralized intake a little bit. Basically, here in Maricopa County, first things first, saw that there are a lot of different programs working in the area. You saw the whole list of them. It can be confusing first of all, for families and for social service providers to find the right program. So they wanted some coordinated way of getting families into the services because there are a lot of great programs. You know, some of them are large and have huge marketing budgets, and some of them are, no one has huge marketing budgets, but they have larger marketing budgets. And some of them are small, and they might just have a few community health workers, but they're doing awesome work in the community that they're serving. So we wanted a way to get families to whatever the best fit program is for them. So we have a coordinated referral system. We have, I have 5 staff plus me. Right now, 3 of my staff are bilingual plus myself. And we get calls from families, we get referrals from physicians, from social service providers, and then we reach out to the family and complete the screening for home visitation, give them the information about what they're eligible for. We make the referral with the home visiting program, and then we also follow up with the program to get the results of the referral back to us so that we make sure we really hold their hand through it and make sure that they get connected with the program that they need. So we follow them up until their first visit with the program, and then we kind of pass it off to the home visitor and let them do their awesome work. Basically, what I wanted you all to get out of this is that all the families, any family who's expecting a baby or with a child birth to 3 can benefit from home visitation services. We see this in the literature that it's not just high-risk families that have benefits from home visitation. Even families that you might consider low risk or moderate risk can also benefit from the home visitation, the child development information, and the support. And then the direct referrals from medical and social service providers really help connect families with these services to address the social determinants of health. We really see it as a partnership between the referral partner, whether that's a physician or a social service provider, and our program, or our home visiting programs, especially at the medical side. You know, they're taking care of the physical health, getting them all the lab tests that they need, and providing them with that important information. And then we can help addressing some of those social determinants of health, like getting them connected with health insurance or, excuse me, or whatever they're needing, and then providing them the parenting information as well. So, I had some ideas about, I don't know exactly who is on the call as far as whether you're working directly with patients or exactly what, but as far as different ways that you can connect families with home visiting, it can be part of your intake process, including the information and like whatever kind of intake paperwork you're doing. During staffings, as you're reviewing cases with your staff or your peers, you're talking about, with this family, maybe they would be a good fit for home visiting. We can refer them to the coordinated referral system if you're in Maricopa County, or another program if you're outside of the state. And I have that on the next slide. Outside of the county, I have that on the slide. Next slide. And then really just putting it as part of your process. When you have patients who are, they come in, it's their first visit, getting them connected with the home visitation program early on, because we see the benefits for them and for their children. So how can you refer? We try and make it super easy. You can refer online. You can refer fax, phone. Online, we have a PDF of a referral form that you can download. And then if you're outside of Maricopa County, Strong Families AZ is the website to go to get the information about the home visiting programs in your area. All right. So thank you all for your time. I'm going to stop sharing now.
Great, thank you, Emily. That's awesome. And then I know that Beth had submitted a couple of cases. I thought we could go through those. Does anybody have any questions of Beth or not Beth, but Emily, before we start with the presentation? I had one. So is there a gestational age limit or after which the baby's born? I know you mentioned you see them all the way up to 48 months.
Yeah.
And some earlier gestational age sound like it had to be before 28 weeks. Are there limits or there reasons you wouldn't use those?
Yeah, so for nurse family partnership, they have to enroll before 28 weeks gestation, but we have programs that enroll families with children up until about 48 months old.
Yeah, because often we'll have patients that don't even achieve getting to their first prenatal visit before 28 weeks. Right?
For sure. So that's just nurse family partnership, though. We have Healthy Families, Health Start, South Phoenix Healthy Start, all different models that work with families who are postpartum or just have 2-3-year-olds.
And then on one of your graphs, and I can't remember which one, but it talked about getting moms jobs or employment.
Yeah.
But the one that didn't actually looked at long-term economic stability. Can you explain that a little bit?
Yeah, so I believe it was parents as teachers that they haven't gone through quite as many trials as NFP and let me see. Oh no, it was Healthy Families. Was it Healthy Families Arizona under economic self-sufficiency? Is that what you're talking about? Probably. So they definitely have, it was probably just the trials that they were looking at for this study. They didn't see that outcome for those particular trials. But I know that they do have, it was probably just the particular indicator that they were looking at. It wasn't quite there for that program, but they do definitely have good outcomes.
So would parent partners be the repository to contact and then help identify where we would send patients to, which programs would help?
Yes, for Maricopa County, yes.
All right.
Because we have, I didn't talk very much about our alliance, but we have the collaboration of all of the different programs. We keep track of openings, and we really keep in touch with all the programs to make sure that that they're going to be able to take the families, that they're not having waiting lists, and we keep updated on all of their enrollment criteria and make sure that that we connect the families with the right program for them. Many of them have different screenings and criteria that I didn't talk about. So that's our job.
Awesome. Well, thank you. That was a wonderful overview and presentation. We'll pull up the case presentations now and then ask Beth Nobles to kind of talk us through these cases.
Okay. I'm with Nurse Family Partnership and have been a nurse home visitor for almost 11 years with Nurse Family Partnership. And I am now a nurse supervisor. But my first case study with you all is a mother of 21 years of age. She was a Gravida 1, Para 0. Her referral came from WIC Services in Surprise, and she began the program at 19 weeks gestation. I met with this client in the first month weekly, and she was very candid and open in the fact that she had been in jail for drug possession and that she had a meth addiction and had a parole officer. So in that going forward, the father of the baby was not involved. She worked in the laundry of the jail. She did not have a driver's license, and she lived about 35 minutes away from her job, where she would walk to the bus station and take a bus to her job and back home again. She was living with her biological father, so the biological grandfather, and she had not known him or been involved he had not been involved in her life until probably up to about the age of 14. So her methamphetamine addiction began at 14. She had an ACE study of 8, sexual abuse, intimate partner violence, history of incarceration. She had a parent with mental illness. Her parents had been divorced. So she was like a sponge. She said that getting pregnant was the catalyst that would change her life, and she would do whatever she could to make her child not have to go through what she went through. So on her first prenatal visit, the documentation from her OB was that she had a urine drug test positive for methamphetamine. Her parole officer was having her drop urine throughout her pregnancy, which came up negative. And so when she delivered at 39 weeks gestation. Her little girl weighed 7 pounds, 8 ounces, 19.5 inches long. She delivered vaginally, and a substance abuse newborn referral was placed with DCS. A urine drug screen and a meconium drug screen came back negative in the hospital, and because of her candidness of her methamphetamine use, DCS did open the case. They put the grandfather, the maternal grandfather, as the safety monitor, and Nurse Family Partnership was there. For a period of time, we were there weekly just as the support for it, to support this client with parenting tips and just helping getting well baby checks scheduled and getting her OB, back to the OB at the postpartum. But I would meet with her every 2 weeks. At 3 months of age, there was, through a developmental screen we did, noted that her little girl was had a developmental delay in gross motor and fine motor. Did a AZIP referral, which they denied on the AZIP referral, and the pediatrician then referred outpatient for physical therapy. Mom would take her on the bus to her physical therapy, and it was from Surprise all the way downtown as to where she would take this little girl. And she began to come around. This mom would read to this little girl. This mom would take any of those parenting tips of attachment and bonding, and she would want to do that. At about a year of age, Mom decided that she wanted to move out with friends, and she moved out from her dad's house and in with friends. And it began a spiral for this client downward. She relapsed into methamphetamine. She did a lot of couch surfing, and she would never let me come to an address. She would only meet me at a McDonald's. So I would watch her get off a bus and come to the McDonald's with her little girl, and we would meet there. And we continued to meet until about 18 months of age, and it got to be 18 and a half, and she wouldn't take her for her 18 months checkup. And as I continued to encourage that was really important, as I was watching the little girl delay get more and more, she finally took her baby to the 18-month well-child check. At that point, physicians did a DCS referral on this mom, and DCS did find her at the address she had put down from the doctor's office, and they took custody of the little girl. And with that, it was the biggest wake-up call for this client. I continued to meet with her throughout this whole entire time. She moved back in with her dad. She got involved in a drug rehab. She used the services that DCS put in place for her, and it took 1 solid year. She worked steadily to get that. I would meet them on joint visitations. After about 6 months, she could have some visitation rates with her little girl. I would meet with her there, and we would see her little girl together. And I graduated my client, and she did not have custody of her little girl, but she continued on, and she would keep in touch with me about every month. And on the 31st of October, I got a text that said that DCS had reunited her with her little girl, and she now has custody back of her. She continues to go weekly to her drug addiction meeting on a weekly basis, and she continues to live with her dad. She's enrolled in a junior college. One thing I will say is to back up kind of is that because of her heavy meth use, she had decayed and lost teeth. And so I was able to connect her with a dental clinic, a low-cost dental clinic, to where that they removed the decaying teeth and gave her dentures for it so that she would have teeth that she would, to be so young and have no teeth was a really big, huge social deterrent for her, as that was a struggle. But she just sent me a little message last week that said, "Nurse Beth, is there anything I could do for you, because you have meant the world to me?" So that one was a real big struggle for me, but in the end, it sounds like, and I'm sure her battle is not done. As we know, addictions are very tough, and it's a lifelong battle.
That's awesome. Thank you. And I appreciate you. Am I off mute? I appreciate you pointing out that substance use disorder of any nature is a chronic relapsing condition. And so I don't know that her course, especially with something as like methamphetamines, is that unusual. And it's just having a champion that continues to stay in the arena with the patient. So thank you for that. That's amazing. When you noticed that the baby was having delay in gross motor skills and you brought it to that pediatrician, how did that go? And can you talk to me about the timeliness and the proactive approach on the medical side of things?
Yes, I sure can. He was a physician that was out in Surprise in the Adelante clinic, and he was fabulous, as I will say. He and I both had such frustrations is that he would put the referral in, and so by the time we could get a authorization for the therapy, as to contact them, the physical therapy to get it done, he put the referral in, and we stayed on it almost weekly. She was not seen until almost 5.5 months before she could get therapy. So that was a huge frustration. And we see that so many times. By the time the wheels turn to get authorization for outpatients, and then we can get them scheduled, especially in the West Valley, as in Surprise and El Mirage, and that the services just aren't as readily available so much. So that was a frustration, but that work in collaboration with that physician was fabulous. He was appreciative, and he had noted it, maybe not quite as early as I had seen it, because I was in there, weekly and then every 2 weeks. So he was grateful that he had eyes in that home that could help.
That's great. That's amazing. I want to make sure that there's not questions are there any questions being asked? You're doing a lot of typing over here. I don't know what. Anybody have any questions online about this case in particular?
Hey Maria, it's Vicky. Can you hear me?
Yeah.
I don't have, I guess, any questions as much as, again, just this is exactly what both women and children need, right? So I'm a family doctor and also a mom of 3 special needs kids. And so this is so important when you stand by somebody and you recognize that their addiction is their disease. And again, just like somebody with diabetes, right? We don't say, oh, well, geez, you're not doing what you're supposed to be doing, so I'm out of here. You stick by them and you continue to work with them and you continue to help them try to make healthy choices. And then that early intervention for the child is again, just so critical. And so the fact that, again, you didn't say, well, we tried, now we're done, too bad. You just kept pushing. And so did the doctor taking care of the child. So again, I just think that we have to remind people that it does work, and for every person it's different. And so again, really, I just thank you for that.
Absolutely.
Yeah, you're welcome.
Maybe Beth and Emily, can you speak to the big buzzword for physicians right now is burnout, but I think in essence sometimes it's a little bit more than burnout. And how do you all, because you see this is your work, how do you address your burnout, aka second, third victim issues associated with your work?
Yeah, for all of our home visiting programs, reflective supervision and support from the manager is huge. I know Nurse Family Partnership is also has a reflective supervision model. We really work with our staff on self-care and just knowing that their manager is trying to support them and being there for them. Beth, maybe you kind of more working in the field might have another perspective on that.
There's a couple things that I see, and yes, secondary trauma to our cases is huge. I think we are in this profession because we care and we're helpers and caregivers. So that is a big check. And we also have an employee program that when it gets hard and you have cases multiple like this in your caseload, that we push for them to get into some kind of counseling and therapy so that they have support other than just with the manager, 1 hour a week. But that is key, and as well as you are doing something that refills you instead of just constantly giving. I think my caveat is those little emails that you see, and that I've worked really hard and I have my baby back. Those sometimes are the greatest thrillers, and they fill me with this is why we do and why I have been a home visitor for 11 and a half years. It's because even if it's just one client you make a difference for, you've made the difference for her and her baby.
That's wonderful. Thank you. Question. So you had talked a little bit about getting texts and receiving texts. Do your patients, what type of mechanism do you use? Do your patients have your cell? Do you have a Google number? Yep. What is the mechanism that you use?
We have a cell phone, and they text us. They FaceTime us. They call us. Any way that they can give, that they want to get a hold of us is that. But it's this population text for the most part. 11 years ago when we started, we didn't have texting capabilities, and I kept saying, we're missing these moms because that's their whole life. And when we finally got texting, boy, it opened up, and these moms, are there. What's interesting is they'll shoot you a physical something, what is this? And instantly it's call your doctor. I am a nurse, but I am no, diagnostician. Call your doctor. So yeah, that's how they get a hold of us.
That's great. That's great. Thank you guys so much. Do you mind if we go ahead and go to the second case?
Nope. Second case is she's a 17-year-old high school senior, first-time mom, gravida 1, para 0. She began the program at 12 weeks gestation, and Nurse Family Partnership does have that criteria that we need to enroll our clients before they hit 28 weeks. And that's just because we want them to be enrolled in that last trimester. I will say this though, there are exceptions. And so if you ever have a client that is past 28 weeks, we have made exceptions to enroll clients past that. So if there's one that, you know, is something that needs, please don't hesitate to give us a call. So in saying that, she again came from WIC as a referral. This mom lived with her maternal, her maternal mother, and a sibling brother. She was in high school, and by the time she had hit her second trimester, the school had contacted the mom for truancy because she had missed so much from being sick in the early portion of her pregnancy. The father of the baby, which was interesting, was very involved and would meet and come to every home visit that we would make. And he was there. Her ACE score, she seemed to be just, in the beginning picture, whatever normal is, a normal teen mother having her first baby. Her ACE score when we did it was 4, and that was for domestic violence in the home when she was a child. And she later through the course of our 2.5, almost 2 3/4 years, she finally came to the fact that she had maltreatment from physical abuse from her father, her mother, and there was lots of domestic violence when she was growing up too. She saw her dad threaten to kill her mother, to where he was incarcerated and then deported to Mexico as he was non-documented, which left this mom and children as a single parent here in Arizona. And so that was a life that she knew. So when she denied any substance abuse at all at the beginning of the intake, and at the time of her baby's delivery, she delivered at 41 weeks, a vaginal delivery, a little baby girl, 6 pounds, 5 ounces, 18 3/4 inches long. You think everything is great, and she tested positive, and baby tested positive for marijuana. So at that was a big aha, and DCS was called, and an open case was done because she had, quote, denied any use of that. So it finally came out as our home visits continued that while she was pregnant and missing school, she and her boyfriend, the baby's father, would smoke marijuana, and she said it was to help with her nausea. So they put DCS in place, and mother and the brother were the safety monitors for it. And both mom and the dad were required to drop urine drug screens, and she completely stopped. The father of the baby did not, and that's what was hard for this mom, but she was ravenous to know all the things about parenting and all the things that was going to, you know, make her little girl, as she would say, smart and not like her. DCS closed the case at 14 months of age on the baby, and about 18 months of age, the birth father was arrested for burglary and incarcerated. And so I continued with mom in this and connected her with the child care health consultations and the scholarship for daycare for this little girl. So she did get a scholarship for our child to be in daycare, and she returned to high school and got her high school diploma. And then she went on and went to junior college, and she was working, and we got her on birth control, so no further pregnancies. And she has finished 2 years of her the junior college and wants to continue on with one of the stateside universities. She would like to be a social worker, but she's the very first person of her family that had attended any kind of college. So she really turned it around. This little girl had no delays whatsoever. Every one of her developmental screens came out just amazing. She was a bright little girl, and I attribute it to the fact that this mom interacted and played. She would shoot me videos of her sitting down playing with this little girl with blocks and reading to her. So she is just doing well. Her little girl is now 3 years of age.
That's a wonderful story and challenging. How often, I have a few questions. One, I noticed that both referrals came from WIC. How often are the referrals from providers, or are there any?
Very little. That's what's been a really, we can't quite understand is that why we can't get providers to refer to us, because we want to collaborate with them if they have, and we know that there are, you know, pieces that they could. These girls really do, I think, not just high-risk ones like Emmett has said, but we have very few referrals from providers.
I will admit it's probably just lack of, even though we're told or we hear it at different conferences, we really, until you experience it, you probably aren't getting very savvy at making sure that's on the checklist of things to do, which obviously it's an important. When you do have a provider involved, do you meet with them regularly to kind of go through the case and progress and just what you need as reinforcement from the provider?
We don't meet physically, but we do connect on over phone and ask them, you know, is there anything that, you know, we could be eyes and ears for you? And of course we're getting ROIs so that we can share, you know, back and forth. And yeah, when we do get that, but there've been so few. I send each and every provider a letter that says, you know, your patient such and such is in Nurse Family Partnership, and if there's anything, please contact me. But again, and with the lack of a lot of marketing, that's why we're really glad to have PPV involved in that they can do a lot. And Emily, you could probably speak to some of that, is that I don't know if any marketing is out to providers.
We definitely have tried. It's been a challenge, and going to those conferences, as you know, is not cheap. So, yeah. So we really try. I know NFP and several of our other programs have, you know, just kind of trying to reach out to the providers in their area. And usually, you know, we'll get a flyer, like they'll put it in the prenatal packets or something like that. But we don't have families calling in from that. We really need the physicians actually referring and telling their clients, you know, yes, you know, call this number, or, you know, making the referral, especially for those, you know, like really both of these patients that Beth mentioned, probably, you know, they wouldn't have like just seen a flyer and been like, oh, I should call Nurse Family Partnership. You know, really just needing someone that they trust to kind of give them that extra little push.
Right. And for providers, the burden of time is big issues. And yeah. I noticed that you do some screening. At what different screenings do you do, and then kind of what intervals? I mean, that may be another way to collaborate and just, you know, let them know we do these screenings, we can communicate the concerns. And I did see you had a no positive depression screen at that time. Do you do that? Is that coming from the provider?
No, we do that, and we do it prenatally, and we do it at the time of intake. We repeat it again 36 weeks gestation, and then we do it 1 to 8 weeks postpartum. We do it again 6 months. We do it then and it's PRN as needed. So if you come in and there's, you know, a very sad client that can almost determine that you're going to do a PHQ-9 on her. We also do a GAD, which is the anxiety screen, just to see. We do IPV, interpartners violence. We do the ACE on our clients. and I'm missing something. Health habits.
Do you probably do the ATOD?
No, we don't. It's
Okay.
one that Nurse Family Partnership has on it. But we're, you know, and again, for the child, we do ASQs at 4, 6, 9, 12, 18, and 24 months. So for the moms in that, when I have a screen that's positive, I help her, or with her, we call her physician and let them know that this is, you know, this is what we have, and just being that support for that mom to get in and be seen sooner rather than later.
That's fantastic. With your permission, normally we just record the very beginning, the presentation that Emily gave, and not so much everything else, but there's just so much information that I'd love for more providers to understand what's available to them. So if you're fine with that, I will include these cases. If you prefer not, I understand.
No, I'm perfectly fine with that.
Great, thank you. And I'll open it up if there's any questions from the participants. Otherwise, I thank you both so much for your time and effort in putting this together for us today.
You're welcome.
All right, with that, everybody, please have a wonderful week. I am heading out of town and gonna go visit Barcelona, so I'll see you next week.